How do you diagnose constipation in dogs?
Of course, finding out what the dog's been eating and if there's been
Right.
any change. We took x-rays because the dog didn't necessarily seem painful to me, just a little bloated, flatulence. Just that one feeding is what caused it.
Are there any other symptoms of constipation that you can look for? Maybe like he's depressed or not eating or...
Yeah, I mean, you hit the nail on the head there. So lethargy, depression, not eating, sometimes vomiting, especially in cats, abdominal discomfort, if you try to pick Fido up and, whatever breed of dog, however you pick him up, if it's a one-hander or a two-hander, you go into the abdomen and, maybe he'll whimper or, vocalize somehow, just, very sensitive when you touch that. The belly, that can definitely be a symptom seen with it. Yeah, those some of the other symptoms that I would, look out for.
How do you diagnose constipation in dogs? Besides,
Yeah,
he's not pooping. Yeah.
Yeah. I mean, I think hearing the history from the owner is a huge part of it. So I would say historical symptoms of tenesmus and all those aforementioned, non-specific lethargy, GI signs, as well as, getting in there, doing a physical exam. And what I mean by getting in there, I mean getting in there with your finger. So the rectal exam is huge.
With a glove. With a glove. Yeah. Mm-hmm.
I mean, I hope that goes
with a glove.
With a glove. and not just a glove, because a glove is going to be painful, very painful. Yeah. You're going to want to coat that with lubricants.
Oh yeah.
Don't just go, first time vet students, don't just go sticking your gloved hand in there. Make sure, you do it kindly.
That's a vet that's never worked in a clinic before. Right. They don't know the lube.
Yeah. I mean, so physical exam, history, and imaging. Abdominal x-rays are really good to look for impacted fecal content. Another important thing that would be done on physical exam would be kind of like musculoskeletal and, emphasis on the spinal cord. Palpate the back, make sure there's no pain there. If the dog has vertebral disc disease, or if you're kind of yanking on the hind limbs and they're whimpering, they're intolerant of you pulling back, then what's the problem there? Could there be some sort of trauma? Could there be a fracture? If there's a history, the owner fails to mention that I was walking him and I accidentally backed into him and then he was limping a little bit. The limp has maybe gotten a little bit better, but the main issue is that he's constipated. Well, that's a very important piece of the puzzle. Exactly. Any type of fall or kick or something, pelvic fracture is a huge differential as far as constipation goes. And so x-rays would be useful to note if that has occurred, but exam, of course, is helpful too. So that's a big one.
The by the way is always fun.
The by the way, it happens at least
it always solves the problem.
It really does.
Oh yeah, there it is.
Yeah. And then of course, finding out what the dog's been eating and if there's been any change. Last week, or maybe I honestly think it was this past Monday, the dog came in for constipation and
bye.
Yeah. It has a history of bilious vomiting syndrome. So that, for a lot of owners, it's something that is first thing in the morning, before eating a meal. My dog constantly is doing this. Just kind of space apart, or maybe do more frequent feedings, and high fiber diet, low fat stuff, potentially some medication for GI ulcers, Prilosec or Pepsid. But anyway, this dog had bilious vomiting, been on this diet for years, the owner feeds it every 6 hours or something, and it came in bloated. And we took x-rays, because like the dog didn't necessarily seem painful to me, just a little bloated, flatulence when I pressed in on, he was a little overweight dog, and then you just could hear it. Yep, all that gas in there. But the owner was away from her food, and so she fed her friend's dog's food that she was at the friend's house. And, you know, it wasn't this high fiber diet. It was literally, I think it was from, not to speak badly about that brand, but, you know, it wasn't what the dog was accustomed to eating. And, you know, just that one feeding is what caused it. And anyway, I told her, you know, here's some things that you can kind of do to help her out, I believe. Pumpkin, Miralax, and, you know, the dog's doing better. But anyway, so that's something that you need to ask as far as, you know, what has the dog been eating? Have there been any changes in diet? And that's a huge question that I ask, as well as medications, because there are a number of drugs, you know, dogs who've been on radiation therapy or opioids for pain, you know, if they had some sort of surgery done and then they're on opioids, and then that's causing the
I've seen those commercials on TV for I have opioid-induced constipation, so I have to take whatever lax to, Yep. Exactly. So yeah, it's like the by the way thing is, my lab has been, his tummy feels bad. Oh, well, what's he been doing? Nothing? Oh, by the way, he ate 3 tennis balls yesterday and 5 of my socks. It's like, oh, all right, thanks. So I say, oh, by the way, you're going to have to wait a few hours, and then we'll, you know, he's going to be in for surgery. So by the way, your bill just went up.
Hey, if you like this video, don't forget to like and subscribe to the channel and share it with all your animal-loving friends. My name is Mike the Voice Monkey, and we will see you this week with Dr. Max on Ask Our Vet.